When I was 11 years old, I went to go get my dad for dinner. Unfortunately, when I got to his bedside, he was unresponsive. My dad had a chronic pain condition and was addicted to his opiate pain medication. Unfortunately, that night he overdosed, and when the ambulance arrived, they were luckily able to revive him. A lot of people would assume that my dad was a bad person, but the truth is that he wasn't, nor are most people that have addiction issues. My name is Amanda Ferguson, and I am an LVN, and I have been working in the field of behavioral health and chemical dependency for over 10 years. The truth is that there is a stigma associated with the words addiction and addict, and it is ever present today. Because of this stigma, there is a large number of people who never seek treatment. Addiction does not discriminate between wealth, knowledge, power, gender, or age. So let's talk about why this stigma is there. According to the NIH, National Institute of Health, in 2015, 10% of Americans struggled with addiction. 70% of struggling addicts did not seek treatment. These numbers have grown even higher since that time. So why don't people seek treatment? It wasn't until 1987 that the American Medical Association and other associations recognized addiction as an actual disease. It's found that the symptoms of this disease are related to bad behavior, which is why it was so hard to fit into the world of a diagnosis. These symptoms are things like stealing, cheating, lying, etc. A lot of people felt like this made it a morality issue and not a disease. So, if addiction is a disease, then how does it work? Addiction is actually a disease of the brain. There is an actual difference in the brain of somebody who is genetically predisposed and somebody who is not. We all have something in our brains called our hedonic set point, aka our pleasure points, our pleasure threshold. This is what it would look like if I wanted to give you a visual image. When there is a person who is predisposed to having an addiction issue, they have a different response in their brain to a substance than somebody who does not. So, if this is our threshold for where we feel pain or where we feel pleasure, when we take a substance for somebody who's predisposed, you get a huge surge of dopamine. This is how high it would be for somebody who has addiction history in their family. For someone who may not be predisposed, they could take the same substance and their dopamine spike would be a lot smaller. So, for somebody who doesn't have any history of addiction issues, they might be able to put it down and walk away. Somebody who is struggling with these issues is only going to want more because a spike of dopamine this high in your brain is very hard to match. So, let's say that Brad Pitt walked in the room. I would get a huge surge of dopamine because I would be like, oh my gosh, Brad Pitt! But somebody who is struggling with addiction may not have any dopamine spike at all and could care less. So this is Brad Pitt for somebody who's currently using substances. This makes it very hard for people to have joy in their life and for anything else to be comparable to the feeling of getting the substances into their body. When you become an addict, bad behaviors ensue. Now let's look at why that is. When you are addicted to substances, there is something that is affected and it's called your midbrain. This is your midbrain. Your midbrain is known as your survival instinct part of your brain. Every animal on the planet has a midbrain. Some only use their midbrain. The midbrain categorizes things of importance in the following order: fight or flight, eat or be eaten, and procreation. What happens with people who are addicted is that the substance that creates that large dopamine spike becomes the number one spot in the midbrain, and people will do most anything to get it, which is why bad behaviors seem to follow. In many studies, it is shown that rats and monkeys will neglect food and drink just to keep on pressing levers that will administer these drugs. In summation, addiction is a public health issue and not something that we can judge as moral character. As soon as Americans understand addiction for the disease it is, the sooner we will be able to start ridding the stigma. To quote former U.S. President Bill Clinton, "Mental illness is nothing to be ashamed of, but stigma and bias shame us all." Thank you.